Hello, everybody. This is Betsy Wurzel, host of Chatting with Betsy on Passionate World Talk Radio, where we enlighten, entertain, and educate. Folks, I am really excited about my guest today. I am like over the moon excited. But before I introduce my guest, I want to thank Jeannie White, who's station manager, who writes the blog, and Lillian Caldwell, CEO, who sent me a press release about my guest. Folks, you know, Alzheimer's, mild cognitive impairment's been around for a very, very long time, like over 100 years. I wish this was discovered when my husband was alive in the early stages. But paying it forward, I have guests on my show who are researching, who have resources, and I'm really excited to introduce Dr. Stephen Cunnane, who is professor and researcher at the University of Sherbrooke in Montreal, Canada. Thank you for coming on, Dr. Cunnane. I appreciate your time.
Hello, Betsy. It's a pleasure to be here with you.
Thank you very much. Dr. Cunnane, can you tell the listeners, you discovered a ketogenic drink, can't even talk right. How did you discover that? How does it help? I want to know like so much about this because I'm excited about it.
Well, it's been a process. Like most people in this sort of business, you sort of stumble on things, and if you get encouragement, you keep going. And if you get discouraging results, you kind of look for something else. And so in our case, we started with the imaging of the brain because we knew that the brain works like a hybrid car. That is to say, there are two types of fuel for it. In the car, it's gasoline and it's the electric motor and the battery. In the brain, it's a sugar called glucose that your body makes, and it's ketones. And I'd known about that, and lots of people know about that. What we managed to do was to demonstrate that with brain imaging, with what's called PET imaging, positron emission tomography imaging, we could see very clearly the well-known problem with the glucose getting into the brain, both in Alzheimer's and in very early Alzheimer's. And so it's like the gasoline's not getting to the engine very effectively in the hybrid car analogy. But we developed the ketone imaging as well. So it's done the same way as for the glucose imaging, but it uses a different tracer to follow the ketones. And with that, we could show that the same people on the same day in the same scanner, that the uptake of ketones by the brain was completely normal, even in relatively advanced Alzheimer's. So we said, well, the fuel problem seems to be there early in the disease process. If we could get more ketones into the brain, maybe we would be able to slow this down. So I also knew that the product we used, the medium-chain triglyceride, was ketogenic. That's been known for at least 50 years now. So the trick was to figure out a way to make it presentable because it's an oil like olive oil, and nobody really wants to drink a teaspoonful of olive oil every morning and evening. So we have to figure out a way to put it into an emulsion or into a drink. We tried skim milk. It worked really well. It made it quite acceptable, not too many side effects. Some people are a little bit sensitive to it, and stomach ache and so on, but most people adapt to it if you start with a small dose. We figured out a placebo, and we went ahead with that approach. So, it was a progressive thing. We started this work 15 years ago, and we sort of crossed the finish line, at least an initial finish line last year. And we were encouraged all the way along, and other people have done this before. We haven't discovered this in a sense. 10 years ago, there was a small company in the U.S. that put an MCT product on the market called Axona. But their results weren't very effective for a variety of reasons, but the principle behind what they were trying to do was correct, and a number of people besides us have confirmed that.
This is exciting to know that this will eventually come out. Now, when do you expect this to come out on the market for people to purchase it, or would it be by prescription from the physician?
So we have a partnership with Nestle in Switzerland. Nestle has put this product on the market. They call it Brain Expert. It's available in Europe, in certain countries in Europe. It's not available in Canada, where I live, and it's not available in the U.S. yet because both of our countries require regulatory approval for this type of product. So the FDA is going to take a look at this file at some point, and our equivalent to FDA here in Canada will take a look at it. It's called Health Canada, and we'll see. It's out of my hands. But even if they don't approve it, I don't think there's any good reason why they wouldn't, but you can't presuppose that this will happen. But this is a product that you and I and anyone can buy. It's totally legal in North America to buy a bottle or a can of medium-chain triglyceride oil. It's been in the natural health food shops and possibly in some pharmacies for many, many years. And you can make the same drink at home based on skim milk or some other type of smoothie-type preparation that you particularly like. And so this can be homemade as well with no risk associated.
That's interesting. I don't remember the name of it was like engineered food. I believe it might have been a drink. This is 10 years ago for my husband. But the pharmacist recommended that for Matt not to take it because it would really knock him out. So does this ketogenic drink, does it cause drowsiness?
Not to my knowledge. We studied it over 6 months. When in our study that was just published, it was a 6-month study. So people took it for 6 months, and some of them had stomach upset. If they started with a lower dose, it wasn't too bad, but most people got over that. But I don't think we have any reported cases of drowsiness. So I'm not sure what product you're talking about. But medium-chain triglyceride, I don't think you could Google it. Anyone could Google it and see. I don't think drowsiness has ever been associated with medium-chain triglyceride.
No, then it probably wasn't it then. I don't even remember the name of it. But I'm so over the moon ecstatic that at least, something is out there. I mean, it's in Europe. I hope they bring it to, the FDA here in America approves it, and Health Canada up where you are approves it. We need something to slow this monster down. And I do wish it was available 10 years ago, 20 years ago with my mother-in-law, but it's really, we need something. And this is a start. Now, when you say the Nestle company, when I think of Nestle, I think of the chocolate company. Is that the same company?
It's the same company. They have,
wow.
I don't know I think they have over 1,000 products on the market. So they go from medical-type products to consumer-type products. And sure, they're in chocolate and they're in all sorts of things like that, and coffee, of course. But they do have these types of products, and I think this is their first attempt to get into the early stages of Alzheimer's disease. But I'm very pleased because it was very challenging for us to concoct this drink ourselves and to give it. It took us 3 years to do the study, and in small batches. It's kind of like a home brew practically. And to have a reputable company be able to prepare it properly, I think is really a big step forward now that we know that it can be beneficial.
Yes, and it's kind of a mixed emotion for me, Dr. Cunnane, that it takes so long to do the research and to do the study and then to put it out on the market. you said you were doing this, like 15 years. It takes a long time, and I belong to many, many support groups, and people, we want a cure. I know this isn't a cure, but we want something, and we wanted it like yesterday. Why does it take so long with the research? That might sound like a not so intelligent question, but a lot of people in my support groups really do, wonder, why does it take so long to do a research on a food, drink, or a medication?
Well, there's lots of answers. Some of the time, the hardest part is getting the money. We were able to convince the Alzheimer's Association USA to fund this project 5 years ago on the first try. So we were really lucky at that stage. There's, the recruitment of these participants. I mean, we did the imaging work to start with, and we built up the story bit by bit. But when you look at the whole field of Alzheimer's research today, I would say that maybe not even 1% of the money that is spent on this terrible disease is spent on looking at this problem of how to get more fuel into the brain and ketones and so on. It's a very minor contribution to the field in terms of who's studying what. It turns out, I think, that it's a very important contribution. So most people there's been a lot of effort that has gone into finding other treatments, and they haven't been successful. But cancer's been with us for as long as anyone can remember, of course. Heart disease, diabetes, there are lots of diseases that take forever to move forward with. There's not going to be any miracle drugs for Alzheimer's disease. But it's possible that some of the drugs that are there and are being used would be more effective if we provided more energy to the brain at the same time. Will we be able to convince the pharmaceutical firms that sell these drugs to test ketones with their drug? Maybe. They may already be doing it, but they won't announce it until they're ready to put something on the market. So I don't know if somebody else is about to announce the same kind of results as us, and they may not have taken 15 years to move forward. I think that's the nature of the problem.
Yes, the money, I'm sure, the funding, and probably getting people involved in the research and the clinical trials.
Yeah. I mean, the university, I've had a lot of elbow room to set up this project and move things forward, and I've been able to get the funding, and we had the imaging facilities here. Lots of university campuses have the type of imaging we do, but not to do the ketones, and I was able to get them to invest in that as well. So there's a lot of circumstances that have to work in your favor to move things forward. Lots of people have a good idea, and maybe they get unlucky in the beginning, or they run out of money, or one thing or another. And when you look back, it's easy to see how things move forward, but there's so many places that it could have been stopped dead.
This is very interesting. I love, the research, and I encourage people. I mean, my husband didn't want to, and really 10 years ago, there really wasn't that many clinical trials going on, not close by where I could drive a mat to, but to get involved in clinical research, because this is going to help future generations to
absolutely
find, a cure or something to slow. If not a cure, which we would love, something to slow this monster down. I think it's part of
the solution. Pardon me, I'm sorry for cutting you off.
No, that's okay. Go ahead.
I think it's part of the solution. I think it's definitely, if the brain doesn't have enough energy, there's no way it's going to work properly. There may be some drugs that would make this even more effective. I think exercise is still very important. It helps get ketones into the brain, by the way, but exercise is important to stimulate the brain in other ways. The social environment, getting enough sleep, trying to control anxiety or correct it if possible, stress, depression. These are all things that strike us as we get older, and ketones will not prevent people from being depressed, as far as I know. So, but that does affect your cognitive state. So it's part of the puzzle that if you can find a few pieces, you might be able to resist the Alzheimer's longer. But it won't do it by itself. I'm sure of that.
That's very interesting. I have heard Alzheimer's being referred to as a third type of diabetes. And so when you mention ketones, it's very interesting to me. Do you know why that's called a third type diabetes?
Yes, it's because it's kind of the diabetes of the brain, in which insulin is not doing its job properly and it's contributing to the fuel problem, like in the rest of the body, but it affects the brain. So diabetes is the main risk factor for Alzheimer's disease when you consider all the genetic component and the environmental component. And the main reason that's type 2 diabetes. So there's enough insulin, but it's not doing its job properly. And the main reason is because people are not moving enough. If you could do a bit more exercise, it can completely correct type 2 diabetes. And that insulin is not able to get glucose into the brain, but it also blocks the body from producing ketones normally. So it's kind of like the brain's in double jeopardy with diabetes. And it's not getting its primary fuel as much as it should, but it's also not able to get the replacement fuel as it would if you were fasting, for instance. The concern that the medical profession has about ketones is that they are associated with untreated type 1 diabetes. People who normally need an insulin injection to control their glucose, that's type 1 diabetes. And if they don't have that insulin injection 2 or 3 days later, their ketones will start to rise very markedly. And this has always been a hallmark of untreated type 1 diabetes. So many physicians are concerned that ketones are associated with a diabetic problem, and they don't want to know anything about them. And I understand that position. On the other hand, it's a problem of a disease that needs to be treated, and that goes without saying that a person who needs insulin for their diabetes has got to get treatment as soon as possible, and that will take care of both the insulin problem but also the excess ketones. But nutritional ketosis is not the same as diabetes-related ketosis. It's a much lower level. So if you take either a ketogenic diet or a ketogenic supplement, that's nutritional ketosis, whether it's the ketone ester, which gives you quite a bang for your ketone buck, or the ketone salts, which are available, or the MCT. They will not cause diabetes, and they are not associated with diabetes themselves. You'll get a transient level of ketones in the blood, and that's how we did it with this project with the MCT drink. People took it twice a day, and they got a small increase in ketones twice a day, and this seemed to help their brain because the cognition, memory, and so on was better 6 months later. So there's a learning curve a little bit for the medical profession to understand that nutritional ketosis is not necessarily dangerous, and that we're giving 30 grams of saturated fat as that's like an ounce of saturated fat a day in the form of this medium-chain triglyceride, but it's not dangerous. It doesn't raise cholesterol. It doesn't increase your waist circumference. It doesn't increase body weight, triglycerides, blood pressure. It's well documented in our paper. We followed this very carefully over 6 months because it was a major preoccupation of ours, and it's not a problem. So it is a safe treatment, and it looks effective as well.
That makes me very happy. You know, people, when they hear triglycerides and fat, Dr. Cunnane, they might think, oh, what about my heart then? Is that going to affect my heart? And this is a safe form of fat that won't affect your cholesterol.
No, it won't affect it. Even a ketogenic diet, actually, which is 90% fat, Normally people would say, well, that's ridiculous. It's going to be dangerous. People have used the ketogenic diet in Alzheimer patients. A good friend and colleague of mine at Kansas City State University has done this, and other people have as well. And people, the biggest issue with the ketogenic diet for Alzheimer's is compliance. It's very hard to resist not having the typical sweet desserts once or twice a day. And as soon as you take those desserts and get the glucose coming in or the sucrose, it raises insulin and it sort of kills the body's ability to make ketones. So they're not dangerous, and there are other people that have shown this as well. And so this is a kind of, we need to educate ourselves. We need to learn that although fat in our diet has long been associated with getting fat and getting heart disease, the evidence is not there to support that. It's much more a problem of refined carbohydrate and low exercise. Now, the ketogenic supplement is not a ketogenic diet. You can eat what you choose to eat normally, whether you're vegetarian or whether you're a meat eater or whatever you eat. The MCT will be converted to ketones in small amounts in a safe way, and you're not obliged to totally radically change your diet.
You bring out a lot of great points, Dr. Cunnane. The first would be that to try to avoid diabetes, and if you have diabetes in your family, I mean, I have it in my family very strongly, is to maintain your proper weight, to eat a healthy diet, to exercise, so you don't get diabetes in the first place, which then opens up a whole Pandora box to affecting your brain and your heart and, other organs. What would you recommend for people to know about your study? What is the main point which they would like people to take away from your study, your research?
Well, I think the main point is that we have what we would call a proof of concept or a proof of principle that ketones can contribute to better brain health as we get older by providing more energy and letting the brain get on and do the work it normally would be doing if it had enough energy. It's been very well established for over 40 years now that as we get older, even if we're healthy and even if we're never going to get Alzheimer's, the brain gets less fuel coming in. And so that puts it more at risk, and some people resist that risk better than others. Ketones are going to help you resist the decline in cognition. That seems to me to be now pretty clear. As we've agreed already, they're not a miracle, but I think they're going to be part of a solution, and I'm sure we could optimize the way this is going to work. So, even as you said, even if there was no problems above the neck for our health, we need to do better to maintain our health and use prevention more effectively for cardiovascular health, to reduce high blood pressure, to reduce obesity, to reduce type 2 diabetes. That's good for the body as a whole, not just for the brain. And what's good for the rest of the body is, in fact, perfectly good for the brain. There's no contradiction in what I'm proposing here. I'm not a certified dietitian. I'm not a certified nutritionist, and I'm not a physician, a medical doctor. So I'm not giving anybody any individual advice. But in a general rule, what we're saying here is that ketones are going to be beneficial for the brain in modest amounts, and there are various ways to get those ketones into the brain. Some people like to use intermittent fasting. Some people like to use a reduced calorie diet. Just by reducing carbohydrates, refined sugars, and increasing exercise a bit, it's going to do wonders for the way insulin manages these fuels, both glucose and ketones. So there's more than one way to approach this. And some people, when they do exercise, they like to swim. Other people like to jog. Other people do something else on a stationary bike or whatever it is. So there are various ways to do this, and there's no single recipe to make this work.
Right. I'm very excited about the fact with this ketogenic drink is that the side effects, or could be stomach ache, something like that. It doesn't affect your mind like a lot of these medications do for Alzheimer's. So if this comes to market, which I really hope it does, and people take this in the early stages, or even if it works in the late stages, they don't have to worry about the typical side effects of when you take something like a sedative or antipsychotic drug. This is a step in the right direction as far as I'm concerned, and I'm not a doctor myself. I'm just a caregiver, well, an ex-caregiver, a past caregiver who saw what the side effects of these medications do and the result of Alzheimer's. And I'm really excited about this. So thank you.
Well, we are too, and I think that we need to use the ketones for what they can offer. And they're not a miracle, but they are going to help people. But everyone needs to take the approach of taking care of themselves and doing things that are good for their body anyway. And so we need to take it on board. For some people, it's going to be a more important change in their behavior and their lifestyle than for others. But that's the only way we're going to help slow down this disease.
Yes, I was wondering sometimes why there is an increase now among the baby boomers that people have never seen before. And, one of the reasons is being, the diet. We were brought up on a lot of processed foods, fast foods that they didn't have, in past generations, and being, just sitting around. Being on the computer and, not being active, whereas past generations, they were active. They didn't have cars. They walked, and they didn't have TV, so they didn't sit there and watch the TV. They didn't have computers. And I think that we need, as baby boomers, and I'm one of them, need to have that active lifestyle and try to do what we can to keep ourselves healthy to prevent these diseases.
Yeah,
and
I agree. But the baby boomers grew up with the idea that there was nothing they couldn't do, and that there would be a pill that would be available for all our troubles and our woes. And I guess we've hit the wall. We pretty much know that now. And there's been a huge amount of effort to get an Alzheimer's drug, and that's going to go forward. And there may be a drug for Alzheimer's one of these days. But even that, like a vaccine for COVID, it's not going to solve all the problems for everybody. So, again, taking care of yourself is going to help the efficacy of these drugs, and it might help you resist needing to go on them longer than if you don't take care of yourself.
That's right. I forgot which comedian it was that said, if I knew I was going to live this long, I would have taken better care of myself.
Right.
I forgot what comedian that was. But, we do, and we're all responsible for our own health and the prevention of getting these diseases. If diabetes runs in your family like it runs in my family, keep your weight down. Go on the Mediterranean diet they recommend, but you have to do what you can do to prevent these diseases. I mean, sometimes it happens, and no matter what you do, but each individual should try to do what they can. And one neurologist told my husband that exercise is the best medicine. Better than any pill on the market is exercise.
Well, it's certainly important. Even as I said, even if we had no problems above our neck, exercise is important for a good quality of life in many ways, and it helps the brain do its job as well. So I would agree. I'm not sure if it's the best, and some people, do have diseases that exercise might help with, but they need some more help beyond exercise as well, or they may be incapacitated and handicapped in some way and not able to do exercise to the level that they would like to or that they should. So, again, obviously if you can do exercise, you should really make an effort to find time for it in your schedule. If you're not able to, then maybe something like a ketogenic drink will help achieve the same goal.
Yes. Well, I want to thank you for coming on, Dr. Cunnane. Very informative. I'm really excited. Can people get in touch with you if they want to learn more about your research?
Certainly. I have an email address, which I think you have, Betsy, so by all means share it with your listeners.
Okay. Very good. Folks, I want to thank Dr. Cunnane very much, and congratulations on your research, and, just keep up the good work, as my dad would say. He also had Alzheimer's, and he was diabetic, but thank you. Thank you for what you're doing to help in this war, and trust me, it is a war on Alzheimer's and other dementias. We need more people like you, Dr. Cunnane, to do research, to get the research going, and we need people who will participate in research. So I want to tell people, if you have the opportunity and it's okay with your physician, then please consider doing research to help future generations. And I want to thank you again, Dr. Cunnane, for coming on Chatting with Betsy. Folks, in a world where you could be anything, be kind. If you missed any of this podcast, you can hear it on Google, Apple, Amazon Music, and wherever you hear podcasts, because that's where you find me, Chatting with Betsy on Passionate World Talk Radio. So, folks, be kind, be safe, wear your mask, and until we chat again, this is Betsy Wurzel, host of Chatting with Betsy and Passionate World Talk Radio. Bye-bye now.